Yes, hello, good afternoon. Thank you, Radar, for a very warm welcome. So I have a lot of pressure now to fulfill the promise of the topic. And it looks like that most of the people are coming back from the lunch, so I hope you had your coffee before my presentation. So, is it a screen spot here to change slides? Okay. My name is Juha Villanen. I am responsible for business development in the Europe, Middle East, and Africa for a business unit called Garmin Health. And then throughout the presentation, I will give you examples of what that exactly means. I'm also a co-founder and a chairman of the board of a Finnish startup called Move with Health and Learning, which is a child-centric health promotion and community engagement platform. So I have this the big device manufacturers had, but I also know that startup side of the digital health business. So helps quite a lot, to be honest, in this business. And I live in Munich in Germany. Been living there for 20 years almost. So I am older than I look like. So and I have a German wife and 2 Bavarian children. So if you don't understand me, just raise your hand then. Garmin, my colleagues, you have maybe had a look at the stand of Garmin there. You can see some part of the very small part of the products of Garmin. But my mother still thinks that I'm doing something with maps and navigation, but that's sort of most of you have heard Garmin in different contexts. Some of you might have a bicycle and you have some kind of a bike computer, or in your car you have a Garmin's navigation device and so forth. But you can see here the 5 vertical business areas of Garmin, which are automotive, outdoor, marine, fitness and wellness, and aviation. So Garmin is a company of 12,000 people, $3.3 billion of revenue, and quite evenly split within these business verticals. And it was founded by Gary and Min some years ago, so that's the name of Garmin. But the navigation, this navigation as a theme will follow up also in the health ecosystem, and I will come back to that a little bit later. And actually, Fitbit was speaking here yesterday, and he also visited our stand, and we were discussing about these businesses, and then we were discussing about differentiators and sales arguments. So I used my Australian colleagues' phrase to say that, we put shit in the airplane, so if they don't work, people die. So I think that was the best sales argument for Garmin's devices. But the Fitbit's CTO didn't like that too much. So. But if we focus a little bit more on the wearables, which are sort of fit a little bit better into the health segment, I speak about the wearables as an example now, but we also have an index scale, a digital scale. You can have a look at the stand as well. But if last year Garmin's total growth was 7%, the biggest growing areas were fitness and wellness and outdoor. Fitness and wellness are typically the activity trackers of different kinds and smartwatches. And even in outdoor, you have some of the smartwatches are qualified as outdoor devices, but are health relevant. So Garmin is doing very well in that area. And I know that in Finland we are, every third of this room has been working for Polar or Suunto, for instance, and you're wearing some. That's great. But in Germany, for instance, Garmin is a market leader in the wearables and smartwatches. So about 27% of all of them are Garmin. So that's coming even in the Nordic region. And as you saw the verticals in the first slide, and maybe this describes also our ecosystem a little bit, whereas Garmin comes from the navigation side, and you have the verticals where cars and airplanes and so forth. So, and at a certain extent, you also see the development of that to our devices. So Garmin's wearables are serving almost all parts of life. So some of you might be playing golf, and there's a golf watch of Garmin, riding a bike, hiking, just walking, fitness, swimming, triathlon, and all. So there is a device for almost everyone. You have them from 25 euros to 1,000 euros of variation. That this is the biggest, let's say, difference to, if you talk about wearables, to a competition. And also the strength, because coming from this health promotion topic at Move It, I know that if you want to change people's behavior, you have to be embedded into their lives. So even I don't say that our devices or the fitness trackers will change a behavior, but if they are embedded into your life, then they have a chance to have an impact. And of course, then you will see some integrations of wearables to cars and so forth. So you control many, even your sailing boat, and so you can control with your activity tracker or smart watch. But now to the beef. So this is the business unit I'm representing, and so far everything was vertical. Garmin Health is a rather small horizontal business unit, and we make around $30 million revenue per year. It's just a business unit of 15 people, and we work based on Garmin's devices. So we don't have any digital services for B2B customers like care providers or hospitals or insurance companies, but we only can embed our devices into ecosystems of application devices, platform developers, and service providers. We focus on very excellent devices and their sensors and their development, and then the connected ecosystem, which is the basis of our business. If you want to take three main areas where we are selling joint solutions with our partners, first of all, it's the most, let's say, simple one is the corporate health or occupational health. Many of you might have had corporate wellness campaigns at your sponsored by your employer and such. This is a quite typical one. Population health, it's a that's a very American way of saying that, but typically we work with health insurance companies and life insurance companies, or then other stakeholders of population health. But typically they have been insurance companies in Central Europe or in the Middle East, for instance. And the last one is closer to research and monitoring, patient monitoring. And in a previous presentation from Heikki, you saw that you have to make a difference of healthcare and welfare, so medical devices and non-medical devices. Garmin doesn't have any medical devices, but even in the patient monitoring, you have preventive programs and rehabilitation programs where doctors are using the data of even non-medical devices like that of Garmin. You can follow the sleep activity, heart rate variation, body weight, and so forth. So these are the business areas. But we don't do anything of them ourselves because we just can provide the devices, and no company or care provider can do anything with the devices per se. So this is an example for a health insurance company that on the right-hand side you can see the needs of a life or health insurance company, for instance, or it could be even a municipal health provider. But if you go from the top, an insurance company, health insurance company wants, of course, to have healthy customers and buying their insurances and so forth. Or then they want to activate or engage with their existing customers and keeping them healthy. You can focus on problems in actually improving the health of your existing insured population. You can do risk assessment and prevention programs. And funny thing is that because I work both in Scandinavia and East Europe and the Middle East quite a lot, so in the European countries, mostly our customer cases are related to the upper ones, where it's acquisition, engagement, health promotion, awareness type of thing. Whereas in the Middle East, you have more of the risk assessment and prevention programs. And let's just take a diabetes 2 as an example. relating to obesity and so forth. So these are, you clearly notice in which status the nation's populations are. Our devices are integrated to different application interfaces to our partners' platforms and apps. But we never can provide these on our own. So that's why we need partners. Second example, it's quite fresh one actually, the patient monitoring one. We have quite a lot of these in the US where private hospitals, even before the people come in, they want to know something about them, or when they go home, they have a Garmin's device which has a 1-year battery lifetime on their wrist, and so they follow that. So even as a non-medical device. Medtronic Garmin is a good example. You can Google it if you like, but that's a very good example for that area. And in these cases, companies like Medtronic or these semi-medical cases, they utilize Garmin's brand and awareness because people don't stigmatize in being patients or ill if they use a lifestyle product like of a Garmin. I mentioned about the ecosystem and that. And so as mentioned, we focus on the devices and everything else is yours. So you know that there are many, many apps for sleep, for activity, for nutrition, for diabetes and whatever. And all of these companies, we have more than 3,000 that we actively work with. And you notice there's Velmo, Heja, are there Fuel, are Finnish companies, and there are quite a lot of North American companies. And these are the ones that we develop solutions for the population health, corporate wellness, or health, and patient monitoring. And we just try to make joint business cases with them and automate and improve our interfaces with them. Whoops. Was that the last slide? No. This is one example, you know, Heja or Hintsa Heja performance. One example of a joint solution, and meaning about the ecosystem. This is a corporate wellness solution. So we work a lot with them in several European countries. And it's a joint offering, as you can see, but it's a joint business case and proactivity on both sides. So coming from the startup side, even in that Garmin is a big company and some of our partners are very small companies, these good opportunities are based on personal relationships and joint business cases, not too much on the technology side. I have another example as well, but this doesn't want to show that. My time is up most likely, then that they want to show. Yeah, this always happens to me. Niin, mä painoin väärää nappulaa. That's why I'm a business development manager, not a CTO, yes, you notice. Next example, insurance case, Fuel, also a Finnish company, a small company, and again here as well. Joint business interests and joint business cases. And these being Finnish companies, and you most likely know. To finalize my case, so we get contacted a lot by these companies, and we provide them interfaces, and then we also discuss with them about joint business opportunities, which is the basis of all cooperation and collaboration. It's not technology comes and goes, but if you find the ways for joint business cases, then you're on the right track. And I would focus on that. It's behavior changes, lifestyle, navigation, and the Garmin comes from the navigation side. I just like to have our devices to be used in that navigation. It makes your turns easier. Even in the previous presentation, sleep is a very good indicator and parameter. But that's where we come in, and we really want to work within this. And the prospects we are having, we want to offer also is the joint offering, grow branding and marketing. Which is good because we are a global company as well. Technology then, application interfaces, direct interfaces, and different Connect IQ apps that you can modify the devices with your own information. And fulfillment is quite important as well, because Garmin is doing everything in-house. So we have our own sales networks and distribution support centers around the world. So that's quite handy because many of the companies in the health segment are global, so they also need the local support for that. And I think now being thrown out from the stage, but I will be around here, most likely at the Garmin stand. So if you want to discuss with me, please welcome. Otherwise, I'll say thank you and vielen Dank.
Vielen Dank.